And then when we hit the top of the hour, take it away.
Perfect. Like watching the minute drop, you're like, waiting.
10,
It was closer
9.
than I thought. Right? Just coming in there. Well, welcome everyone. Good morning, good afternoon, good middle of the night, wherever you are, to our Monday call. So a couple reminders, we would love for you to share in the chat where you're coming from. Hello and welcome. And we're very excited to have you here. If you've got any national updates that you want to share, we're going to do it a little bit different today. If you could just put those in the chat. We've got an amazing speaker today, so I want to spend time really digging into that material. So put your national updates in the chat. Let us know where you're coming from. And any questions you have, we'll be able to field them from there at the moment. Our question of the day is kind of fun. It is in honor of International Dog Day, which is today. So I'm going to ask Danelle, if Dog Day turned into a national holiday, what activity would you do with your pet to celebrate?
That's hard. So I'm really close to, the redwoods. So in the Skyline Hills, I probably would take Echo, my Pity mix, and then Low, my Yorkie mix up, and we'll probably, do a little bit of hiking for the day. I think they would enjoy that. I would, get my workout in. What about you?
I have an old senior lady, so we have a little bit of a restriction. So that means like throwing the ball about 20 feet in the yard. And she is a mix, half golden, a quarter Weimaraner, a quarter lab. She looks like a black golden, but she likes to lay in the sun. So I would just lay in the sun with her, and then she gets hot, and then we go lay in the shade. And that is her ideal happy day, as long as there's lots of treats sprinkled in. So I would just honor her in that way.
Oh, that's so sweet.
So love these wonderful answers coming in here. Dog park dates, sniff spots. That's always super fun. Going to
Lake
lake.
Day.
Yeah, these are great. Great ways to celebrate with our pups. I want to introduce our speaker today. We're really happy to have Dr. Sheila Segurson with us. She is a veterinary behaviorist. So she's a board certified behaviorist and the director of shelter solutions for Maddie's Fund. She's worked with the team for 11 years, and she has over 25 years of experience in animal behavior needs, supporting specifically the animal welfare organizations. She does live in the Bay Area near Danelle, and has, I just learned, several pets in fosters and a teenage son. So she has her hands full. And I welcome her today. She's going to share with us those questions we all have, especially as times are changing here, about the behavior and the medical impacts of spay and neuter. Huge dialogue. Welcome, Dr. Sheila.
Thank you so much. And it's good to see so many people here today. I am happy to talk about this topic. I just want to start by saying thank you to all of you who put on these calls. A lot of work goes into picking the speakers and the topics and making sure that everything is running well, and you all make it look so smooth and easy. But just thank you for all that you do, and for everybody that joins these calls. I am going to share my screen. All right. Can you see that?
Yep.
Okay, great. Thank you. So the topic that I'm going to be talking about today is one that many of us have very strong feelings about. I feel like this topic is one that we could probably spend a week talking about, because there's so much research out there nowadays. But we have a short period of time today, and we're going to cover as much as possible. I want to start by saying that the information that I'm sharing today is based on my own experience and research, and does not necessarily reflect the views of Maddie's Fund. We are going to be using a tool called Slido to allow you to express your opinion during this presentation. You can either access Slido by going to the website slido.com and entering the number, or you can use your phone, scan that QR code, and access Slido that way. We're going to do a little test question here so that we can see if Slido is working for all of us. So I'd love for all of you to either scan the QR code, go to slido.com and answer this silly question, or maybe not so silly for some of us. If money wasn't a factor, would you rather be the leader of an animal welfare organization or an animal caretaker? And so we can see up here that we have 20 responses coming in so far. Let's keep them coming. And it looks like more of us would rather be the leader, but animal taker is jumping up there. I actually am someone who would vote for that animal caretaker role because I love just spending time with people and pets, and I love being a caretaker. But more of you disagree with me and rather be a leader. So great. It looks like it's working. We have a lot of responses here. And so we'll be using this periodically throughout the presentation. So on the left, we see a recent post from Maddie's Pet Forum from just a couple of days ago. Someone asking what to do about the feral cats in their community, and very few of them are fixed, and they want to help the cats in their community and as much as possible. And what the heck are we going to do? I'm sure many of us really feel towards posts like this, figuring out how to manage these very difficult issues where animals' lives are at stake. On the other side of the coin, on the right, we have an 8-week-old, what looks like a German Shepherd mixed puppy. So she's a large breed dog. Let's say you found her on the street or fostering her for an animal welfare organization, and you've decided that you want to adopt her and you want to do everything possible to help her live a long, happy, and healthy life. What is the best thing to do for this dog? And so that's some of what we're going to be talking about. What is the best thing for an individual dog? What is the best thing when we're talking about these big picture issues that impact individuals? This need one slide in here about cats because we're mostly going to be talking about dogs today. The research in cats garners pretty widespread agreement that spaying and neutering cats before 5 months of age is pretty much always the right decision. There isn't significant risk that we know of to significant risk to neutering and spaying cats early. So because the controversy is around dogs these days, we're going to be focusing on dogs, but I do want to acknowledge cats. So many of us, I'm sure, probably feel that spay neuter is the right decision for all dogs before 5 months. And the Association Veterinarian Guidelines for Standard of Care in Animal Shelters tells us that we want to neuter animals before they leave for adoption. So, and we probably all know that neutering quite early is very common in animal shelters. So that's one piece of the coin and how most of us feel here in the United States, or most of us in this audience within the United States. But it's worth mentioning that the views about spay neuter in the United States are not necessarily views worldwide. In fact, spay neuter is illegal in a few countries unless it is medically justified or if it will significantly benefit the animal's well-being. So feelings about spay neuter. So some countries in Europe feel that spaying and neutering is altering animals in a way that is not in their best interest. So views can differ very, very widely depending on where we live and depending on what we read. So we're going to jump in and talk about what the research says. But before that, I just want to get a little bit of a better picture of you all. So I'm going to have you once again jump back on Slido, and you're going to answer a couple of questions regarding spay and neuter. The first question is and so please jump right on while I'm talking. The first question is related to whether we're seeing more versus less puppies or kittens in shelters nowadays versus what we did 10 years or so ago. The second question is looking at our level of understanding, our feelings about our level of understanding about this topic. The third is about what is actually done when we spay a dog in the United States. And the last question asks about which of the following items in that list is elevated long-term after spay-neuter surgery. You don't need to spend a lot of time thinking about these. This is not something that you're going to get graded on. It's just helping me to understand where everybody is with regard to this. And so while people are continuing to enter your answers, I'm going to start looking at the responses to some of the questions. And so with regard to puppies and kittens, our responses are pretty clear in that we're getting close to 60% of us feel that we're taking in more puppies and or kittens than we did pre-pandemic. Lots of other responses to that as well. That is my experience locally as well, that we have a lot more puppies in shelters locally than we did 5 years ago, for sure. So this just emphasizes the importance of talking about this topic and obviously spay neuter. All right, next question is what is your level of understanding about this topic? And we can see that most of us feel that we're pretty much in the middle, with some of us feeling we have expert level knowledge and some of us being new to this topic. You can see the number of people who responded to each question up here. So what is most commonly done during a dog or cat spay? And 35% of us said the animal's ovaries, uterine tubes, and uterus are removed. That is correct. All of these are removed during spay surgery. There are other ways and other things that we can potentially do, but this is what is most commonly done in the United States. And thank you for all of you who are comfortable saying I'm not sure, because it's something that generally know what a spay is. It prevents animals from being able to reproduce, but what does it actually do? All right, and then the last one, I'm not surprised to see this is one that is more of a sciencey veterinary question that most of you do not know the answer to this. The correct answer is that luteinizing hormone, or LH, is a hormone that is elevated long-term after spay-neuter surgery. So thank you all for your responses there. I'm going to start with a basic definition to make sure we're on the same page with some of the terms I use. Gonadectomy refers to the removal of the gonads, the ovaries or testes, to prevent reproduction. And in the United States, this procedure is usually called spay in females and neuter in males. If there are other terms that I use during this presentation that you don't understand, please ask, because if you have the question, someone else does as well. All right, so let's talk about the medical impact of spay neuter. So in terms of medical benefits of spay neuter, those are pretty clear. Spaying and neutering prevents pregnancy. It prevents pregnancy complications. It prevents potential future dog and cat death from preventing unwanted animals from being born. And I hate to say unwanted because I feel like every animal should be wanted. It reduces the risk of mammary tumors, and it eliminates the risk of reproductive cancers because we're removing those things. One thing to mention, and why I have this graphic up here, is that modeling studies and research estimates that we need to be neutering 70 to 80% of the population in order to stabilize. So if we want to get to a place where a similar number of animals are being born to a similar number dying, we want to get to the 70 to 80% range. This is a graphic that was generated from ChatGPT. It's an estimation. It's not from an actual research study. But most estimations tell us that we are pretty much there, and we're maintaining in the 70 to 80% range. Yet everybody answered that question, or a lot of people answered that question saying, oh my gosh, we're seeing more puppies and kittens. So we would think, based on the science, that we should be in a place where we're really good, but we're not necessarily there. There are multiple research studies when we're talking about benefits that found that spayed and neutered animals live longer. So you can see a reference here. This other reference is actually a reference that found that in Rottweilers, neutering them resulted in decreased longevity. And that's one of the things that I like to talk about with research is when we do a study, that's one study. And what we need is lots of studies over time that allow us to say this thing that we think is actually true. And this is pretty consistently true for dogs and cats, that spaying and neutering you allows you to have a longer life. But an important thing that we like to talk about related to research is that correlation does not imply causation. And what does that mean? So that means that two things might be related or correlated. So this graphic tells us that two things are related to hot summer months. One is that ice cream sales go up and people get more sunburns in the hot summer months. So they're correlated. They happen at the same time. That leads us to imply that maybe ice cream sales cause sunburn or sunburn causes ice cream sales, when in fact that's not true. It's actually another factor that is causing those two things. So the concept of correlation does not imply causation is an important one. This is a webcast I suggest you watch if you want to learn more about evaluating research, and we have some references that we'll share with you. So when we're talking about spay neuter, we can't be certain whether that increased longevity is because people that spay and neuter their pets are more likely to do other things like keep their pets indoors, or they have more money to spend on medical care, versus there's something very specific related to removing an animal's gonads that result in a longer life. I hope that makes sense. All right, we're going to jump into our next question. This is actually an open text question. You can respond more than once if you would like. If you don't know, you don't need to answer. But please jump back on Slido and answer this question. What are some of the actual or potential medical drawbacks of spay neuter before 6 months? All right. So we have a not sure. There's comments related to bone growth. Comment related to urinary incontinence and the growth plates, bone growth. Yes, that is all related. Lots of comments about that. Hip and joint issues, bone strength, cancer. Lots of great answer coming in here. A smaller size, someone says. And a lot of people who aren't sure, which is why we're all here today, right? Great, thank you. Okay, so what are some of the potential medical drawbacks of spay neuter? I say potential because once again, correlation versus causation things, but there are numerous studies that tell us that there are more joint disorders like cranial cruciate ligament rupture in some dogs who are spay neutered as compared to dogs who are left sexually intact. The same goes for certain types of cancer. Spaying and neutering has been associated with increased rates of osteosarcoma, which is bone cancer, mast cell tumors, which is usually a skin tumor but can be internal, hemangiosarcoma, and lymphoma. So association there. Also an association with an increased risk of urinary incontinence in females. There are other potential risks as well. Hypothyroidism is one that is potentially associated with spay neuter, decreased caloric requirements, so needing less calories and therefore making us prone to obesity if we don't reduce calories. So once again, correlation does not imply causation. Got to mention that again. And this is that growth plate thing that a number of you mentioned, and I just want to talk about it a little bit more as demonstration that hormones and the lack of hormones do change our bodies. So Apologies. So this is the back leg of a dog. The big bone there is called the radius bone. This is a puppy actually. And this here and this here are the puppy's growth plates. This is where the bone grows from and lengthens, as compared to an adult dog where those growth plates are closed because this dog is done growing. And our sex hormones influence when the growth plates close and when those bones stop growing. So early spay neuter increases the length of time that bones grow, which results in a taller pet. So these are dogs from the same litter, different image quality, apologies for that. But the dog on the left was spayed between 6 and 12 months. The dog on the right was sexually intact. You can see the physical differences in these dogs. And this is something that in private practice, I saw pretty regularly in dogs who are spay neutered. So we know that there can be physical differences. We know that taking away hormones can change things for us. So this is one of the big studies that has been done on this topic. So looking at 35 different breeds of dogs and their risk of joint disorders, cancer, and urinary incontinence. This graphic and the one on the next page are suggested neutering age guidelines for 40 breeds that come from this paper, as well as one other paper published this year. And they make recommendations based on the research that they have. We could talk a lot about this research. Some people say, is this research really true? It was research done at a veterinary teaching hospital, which might be a different population than our standard pets that are out there. But asking questions is good. And when we learn more, then that can lead us to asking more questions and getting more answers. So as an example here, Doberman pinchers, it says for female dogs that it's recommended not to spay them earlier than 24 months. That is not because of cancer in Dobermans and female Dobermans. It's because there's an increased risk of urinary incontinence in Dobermans. So a second page of this, obviously we don't have time to look at this in detail, but we are sharing the slides. So if you do want to take a look at this later, you certainly can. So in summary, medical impacts of spay neuter, the benefits are clear. When we're talking about risk, that research that I just shared told us that the risk is lowest for small and medium sized dogs, where the risk tends to be the highest is in large breed dogs. Like this is Jasmine, my German Shepherd from when she was a puppy. And with a large breed dog like this, I adopted her from a foster-based adoption organization. And because she was a German Shepherd mix, I was really concerned about the potential. I'm going to have this dog for a really long time, and German Shepherds tend to get more joint problems. And so I delayed spaying her because I knew I was going to be responsible and not breed her. And I wanted to do what I could to eliminate that risk for this particular dog. So let's jump in and talk about behavioral impact of spay neuter. I'm going to skip this question just in the interest of time and just jump right into the answer. And that when we're talking about benefits and of spay neuter, for dogs, we know that behaviors associated with reproduction, so behaviors like roaming, male-male fighting, so roaming to find a mate, fighting with another male to get your mate, and urine marking to let other males know that and females know that you're around there. These are all things that research tells us are likely to be influenced by neutering. However, how many of us have been recommended to us or have recommended to others that if you have an aggressive dog, you should neuter your dog because neutering that dog is going to reduce aggressive behavior? That's something that is very, very commonly mentioned. And research is telling us that sexually, so this is Farhudi et al. From 2018, that are telling us that in this study of more than 13,000 dogs, sexually intact dogs were not more likely to display aggressive behavior than were dogs who had been spayed and neutered. In fact, there was a higher odds of moderate or severe aggression towards strangers in the neutered dogs versus the sexually intact. Okay, and so let's jump into our last, I believe this is our last Slido question here. What are some of the actual or potential behavioral drawbacks of spay neuter before 6 months of age? Don't know, that's okay. That's why we're talking about this today. All right, so we've got some don't knows. And I think that's all we're going to get. Oh, we have an anxiety. I saw an anxiety in there. Thank you. We're going to get a lot of don't knows because there's a lot we don't know with regard to the impact of spay neuter on behavior. So thank you for chiming in there. All right. So, but what does some of the research say? The research, there's lots of research on this topic these days that tell us different things. And some of the research is, we look at the quality of research, and some of the research looks at, well, is this research really looking at how long an animal was sexually intact before they were spayed or neutered, because that could potentially influence things. And so this was a quite a large study. This is the one on female dogs. I'm going to show one on male dogs as well, that looked at the behavioral risk in female dogs, looking at, and this is a big mouthful, the percentage lifetime exposure to gonadal hormones, or PLGH. What this study means when they say PLGH is that this study looked at the length of time an animal was exposed to gonadal hormones. So an animal who was spayed or neutered at 5 years had 5 years of exposure, and an animal who was spayed or neutered at 8 weeks had very little exposure. So they looked at actual exposure, which was very, very unique, and something that many researchers had been wanting to see this research, to look at what is the relationship between actual exposure. Once again, correlation, we don't know about causation. And so this study used the CBARC, or the Canine Behavior and Research Questionnaire. If you haven't seen this questionnaire is one that asks a number of different questions, excuse me, around 100 or maybe a little over 100 questions about very specific things. And if you're responding to this survey for this dog, you can see that it says some dogs display aggressive behavior from time to time. It tells the respondent what signs of that might be. And it says, by clicking on the following scales, please indicate your own dog's recent tendency to display, so they're not talking about all time, to display aggressive behavior in each of the following contexts. And so as an example, one of the questions in the aggression category is, what does the dog do when toys, bones, or other objects are taken away from a household member? And we can respond anywhere from no aggression to at all to serious aggression. Oh, sorry, jumped ahead. Which means snaps, bite, or attempts to bite. Or you can say, this isn't applicable. This isn't a situation my dog has been exposed to. So that's the CBARC. It's a survey that gets used a lot in research because it was a survey that was validated. And so this study on female dogs, and bear with me as I explain what these mean, this study in female dogs, so when we look at the training category of questions, so we just looked at that page with questions on aggression, those questions, and that was just one page of the questions, but can be further broken up into aggression to family. There are 8 questions on the survey on that, aggression to strangers, aggression to dogs, 8 questions on that as well. So for all of these different categories, I have the number of questions listed here. And when there is a red color here, it means that this it means that there was a negative impact of spay neuter. So sexually intact dogs were, were less likely to have training concerns. Sexually intact spayed and neuter dogs were more likely, sexually intact dogs were less likely to display aggression to stranger and aggression to dogs. The 25% doesn't mean, apologies, this can be pretty confusing, doesn't mean they were 25% more likely. It means that of the 8 questions in this aggression to dogs section, 25% of those questions were ones where spayed and neutered were more likely to display aggression to dogs. I hope that makes some sense. The 2 green boxes are areas where spayed dogs were less likely to display these behaviors. So spayed dogs were less likely to display howling when separated from people, and they were less likely to chew inappropriate items. You can see miscellaneous items is listed twice just because there were some things where there's a negative impact of spay neuter correlation and some where there was a positive. So this study is looking at especially of behaviors that we are concerned about, and we tend to be very concerned about aggression, that in female dogs, it appears that they're less exposure to sex hormones. There's a correlation with being more likely to have behavior challenges. Same analysis was done in dogs, this time with a slightly smaller number of dogs, a little less than 10,000. I forgot to mention that these studies excluded dogs who had been neutered for behavior problems or to prevent behavior problems, or if the vet recommended neutering for behavior problems. Those dogs were excluded from these studies. And so when we look at males, we can see the interpretation of this is the same. So red means these behaviors are more likely to occur in neutered animals. We can see that for many different behaviors here, in fact, the majority of the behaviors, neutered animals were more likely to display, or animals with less exposure to gonadal hormones, more likely to display aggression to strangers, aggression to other dogs, non-social fear, dog-directed fear, stranger fear, fear of the veterinarian, sensitivity to touch, like not liking to have your nails trimmed. What dog likes that? Excitability, and then miscellaneous. Similar to females, neutered dogs with less exposure to gonadal hormones, neutered dogs were less likely to howl when separated from their owners. That's an interesting one. Are neutered animals less likely to have separation anxiety? The research definitely does not appear to be pointing us in that direction related to other studies are out there. The other positive was that neutered animals were less likely to display urine marking indoors. That makes sense because urine marking tends to be something that sexually intact dogs tend to do. Male dogs tend to do a little bit more. So these were 2 big studies on male and female dogs. I could spend a lot of time talking about these and other studies. The bottom line is that at this point in time, there appears to be more research pointing us in the direction of spay and neutering being associated with behavior problems. Once again, correlation versus causation why is this happening? Is it actually related to removal of the gonads? We don't know for certain. Other studies another study looking at behavior and cognition. This is one of particular importance to me. And so this is a 2001 study by Ben Hart. So the same name you saw mentioned in those studies looking at medical risk factors. Dr. Ben Hart was actually my mentor, one of my mentors at UC Davis when I was doing my behavior specialty training. He started off as a veterinary anatomist and has been a really long and winding road, and is just a really curious person who is interested in learning about the effects of our anatomy on the things we do and how we do things. And so this study looked at spay, neuter, and the likelihood of cognitive impairment. So things like cognitive dysfunction. And this study found that sexually intact male dogs were significantly less likely than neuter dogs to progress from mild cognitive impairment to severe impairment during the time between a first and second interview. The study tried to look at males and females, but there were no intact females in the study. All the females were spayed, so they could only look at males. But this is an interesting topic to me just because as someone who is old enough to be going through menopause, we know that menopause can potentially affect our memory and memory retention at some times. And there's research in people about this, and it's something to think about in animals as well. Does exposure to gonadal hormones protect our memories? It obviously doesn't protect completely because there are lots of people out there with poor memory who still have their gonads for sure. But something to really think about as we think about our dogs. And this is something for me that is a really important one. My dogs tend to live a long time because I do my best to take care of them. And I've had more than one dog who's had age-related cognitive decline. And so this is something I think about. We don't know the risk in females at all, but more information is more information for us to think about and discuss. This is a picture of one of my foster puppies who just got adopted yesterday. Had to put one picture of them up there. But when we look at the overall behavioral impact, we know that there is a positive impact of spay neuter for behaviors associated with reproduction. So those behaviors tend to happen less. Otherwise, there is either a neutral, a questionable, or a negative impact or correlation of spay neuter on behavior. The research is telling us, in my personal experience as a veterinary behaviorist, that spay and neutering is not highly likely to have an impact on aggression. The vast majority of my patients are spayed and neutered. The vast majority of my patients also have aggressive behavior. Once again, correlation, but when we have aggressive behavior, we need to think about why that aggressive behavior. Are we have a situation with two males fighting in a house over a sexually intact female? That's a situation where I say that it might be affected. Otherwise, we really need a lot more research in this topic over time. All right. I'm going to end by sharing some key takeaways from this presentation, and then we will turn things over for question and answer. This has been a really rapid fire run through this topic. Important things to remember. Spayed and neutered dogs and cats live longer. That's something that is irrefutable. We know that there are very clear benefits, especially in terms of population control for spay and neuter, but removing the gonads is not without risk. There's always a risk of medical complications that is very, very low in experienced surgeon, but it is not without risk. And we've talked about some of those potential risks. The timing of spay neuter may be different in animal shelters than for dogs in homes. This is an article from Humane Pro magazine that makes recommendations with regard to age of spay neuter, and you can see that in their recommendations they say that for a male or female shelter dog or cat, the recommendation is before adoption, which can be as young as 6 weeks of age. Whereas we're talking about in this particular article, when we talk about different categories of animals, the risk, the recommendation is different. So with small breed dogs, recommendation is spay and neuter before 5 months of age. But with a large breed house pet, the recommendation is to spay and neuter after the growth plates close. Our last key takeaway is that we really need to consider the risk versus benefit when making decisions regarding timing for dogs in homes. When we have an individual dog, and my dog Jasmine is on the left, my previous dog Herbie, who lived until he was 17, is on the right. I make decisions for my dogs knowing that I'm a responsible dog who is not going to let my dogs roam, and I protect my space very carefully so that my dogs don't escape. These are situations that for my dogs, I am more concerned about other types of risk. Whereas when we're adopting an animal out, we don't know who is taking that animal, not judging here in any way, shape, or form. But there's just a higher risk to adopting out an animal to someone, whether a sexually intact animal to someone, whether we don't know whether they're going to be able to spay or neuter their dog, versus me, who I'm a veterinarian who has a lot of access to spay neuter. And so we really need to think about those individual situations when we're talking about our own dogs and our own pet dogs. And once again, small dog neutered very early, bigger dog, I waited longer with her. All right. That is the end here. And I think we're ready to open up to questions. Thank you all so much. I'm going to stop screen sharing.
Thank you so much for sharing with us. It was really an important topic. I think it's very confusing. We have so much research out there and looking at this data. So I know that you've been able to provide all of us with a really great reference guide, and that you did share a lot of the data. But wanting to address some of the questions in the chat is, how robust and accurate do you feel like a lot of this data is?
That's a great question. So I said this earlier, one study is one study, and that doesn't mean we can take this one study and mean it applies to everyone. One study done in the United States is very, very different than one study done in England. There are regional differences. There are so many differences everywhere. So that is one big factor. And evaluating the quality of research is very important. When we do research, it really should be all about asking a question, being open to whatever the responses may be. I talked a lot about correlation. So most of these studies that we've talked about here, it is all about correlation. And yes, I see the comment. It is confusing. It remains confusing. I totally agree with that. And what I hope that we will all do is just keep learning, keep coming to talks like this and learning about the research that is out there and learning how to evaluate research critically, because I can poke holes in pretty much any study that's out there, because there's challenges to almost everything. I don't know if that answers that question adequately enough.
I think it's a good reminder, and because it is confusing. And so I think just giving everyone a permission to feel confused, that the data is really not holistic, and the questions raised in the chat and what you're describing is really that nothing is really guiding us other than tidbits of information. And I think Julie said it excellently in the chat, like in lieu of the complications of animals facing death or not having a home, that the risks that you're talking about balancing, certainly in shelter situations or rescue situations, that early spay neutering, that cost or risk is probably still of great benefit versus pets that are in homes. And Maria addressed a question too, is we have a huge backlog and a shortage in the veterinary industry of being able to supply those types of surgeries in a reasonable frame of mind. And could you just weigh in on whether or not those pets should wait in the shelter system, or can they be at home with families and then come back for that surgery?
I think I do not have the answer to that question. I am someone that, as a veterinary behaviorist, I do not want animals living in shelters. So I tend to lean towards that side of things. And I know the dog that I most recently adopted, because of the backlog, he was not neutered until after I brought him home. But what is the access? Are people going to have to wait a year before that happens? And then they've completely forgotten about, oh yeah, I should have done that. So there's just so many things to consider related to that, in terms of how easy is it going to be? Did this person have to travel a far way to go adopt the car, and they don't have transportation to get them back to spay neuter? So there's just so many factors to consider when we decide, is it required that we spay neuter before adoption? That is the recommendation of the Association of Shelter Veterinarians and most veterinarians out there, myself included, that we spay neuter before adoption.
And I would have to agree, that's exactly my experience as well. But I think that it's definitely in that place that we need to have some creative solutions in those really isolated areas, that there's a geographic isolation or that there is a backlog like that. So I encourage everyone to get creative, right? If it's a callback system, or, here's your visits or your education guide, or a sponsorship or coupon to be able to return, that might be a great thing. I did have a clarification question. Could you review the effect of spaying and neutering on the height of dogs?
Yeah, for sure. So dogs who are spayed and neutered are likely to be taller than dogs that are left sexually intact. So our sex hormones influence when our growth plates close. So we remove the sex hormones, the bones grow longer, animals tend to be taller.
Great question. I think that was confusing because it almost didn't seem to compute. But in findings compared to humans, we see that is related to bone density. So the lengthening versus the density might change based on those hormones. And we certainly experience that. As you mentioned, with women in the aging process, the effect of those hormones on the density of the bone. Wonderful for you to share. I really appreciate you sharing with the audience today. And I'm sure that there could be a million follow-up questions. I encourage everyone to be active in the forum. This is confusing, and this is something that's pretty dynamic. Someone brought up changes in data that's 20 years old, and the amount of things that have changed in 20 years, even the society, the nutrition that's available, and the knowledge of, the average pet parent.
Yeah,
So
so much to think about. And I'd love to share one last excerpt from the Starling paper, one of these studies. And the paper says that thousands of dogs are euthanized. I would edit say hundreds of thousands of dogs are euthanized in shelters and pounds annually in many developed countries. The reason why dogs are euthanized in shelters varies, but problem behaviors feature heavily. Recent reports suggest unwelcome behaviors are more prevalent in dogs that have been gonadectomized for reasons other than behavior problems. One possible reading of these data is that gonadectomy may reduce the numbers of unwanted dogs, but may also increase the likelihood of problem behaviors that reduce the appeal of the gonadectomized dogs, compromise the human-animal relationship, and make dogs more vulnerable to being surrendered. And she ends by saying there's a need to clarify if that is the case. It might not be correlation, so that we determine when gonadectomy is in the best interest of dogs. And we know, like we've talked about, in virtually all cases, we are dealing with so many animals. It is the right decision for us in shelters, but let's keep thinking and talking about this.
Thank you so much. And I would hope I can ask for a resource on the behavior, like the definitions of what those things are. If you've got a resource for that, I did not check if it was already in the list, but I think that's a great reference. There were some questions about like, what are those parameters that defines a particular behavior? So that might help people interpret the data based on what they're seeing in those animals.
Okay, great. Yeah, I will take a look at those questions and I'll share information about that on Maddie's Pet Forum.
Okay. Perfect. Thank you so much. Any last questions? I definitely want everyone to feel free in the link to make sure that you have clicked on the link to register for the drawing. We definitely want to make sure everyone has that chance to be able to win some money for their particular organization. Thank you all for being here. Thank you so much. The discussion was fabulous in that topic today. Donnell, wanted to thank you for being co-host today. And you have any comments for us before we go?
Yeah, thank you, Dr. S, for this. I do a lot of spay and neuter for the public. So this gives me more of a dialogue to actually talk to my clients and figure out what works best for them. So we're not pushing them to do anything they're not ready for, but also figure out what works best for the animal. So thank you for today. I really appreciate this.
You're welcome. Good to see y'all.